Good afternoon, everyone. Welcome to our fourth webinar in our Forward NUMED series entitled Cultivating a Mentally Resilient Workforce, proudly presented to you by Newcastle University Medicine Malaysia in collaboration with College of Physicians Malaysia and Yayasan Health on World. My name is Shira and I'll be your host for this event. The impact of mental health issues in the workplace affects individuals and the productivity of an organization. Employee performance, rate of illness, absenteeism, accidents, and staff turnover are all affected by employees' mental health. With this event, we aim to provide a roadmap for corporate leaders and individuals through engaging in conversation to support individuals in mental health and well-being. We hope that participants in this event will learn how to foster a more inclusive workplace culture that reduces the stigma associated with mental illness. Without further delay, I would like to welcome Professor Chris Baldwin, the CEO and Provost of Newcastle University Medicine Malaysia, to give the opening speech.
Thank you, Shira. Good afternoon, everybody. And I would like to extend a very warm welcome to you all for the first Forward Malaysia webinar of the 2021-2022 academic year, entitled Cultivating a Mentally Resilient Workforce. And what a really important area this is for us to discuss today. I would firstly like to spend a special welcome and thank you to our two guest speakers this afternoon. Firstly, Dr. Norazam Harun, the Hospital Director of Hospital Permai, who will be speaking on the implications of the COVID-19 crisis on mental health. And secondly, Dato Aliyah, founder of AKRAB Resource and Yayasan Health on World. And she will be speaking on how we mould the future of workplace mental health in Malaysia. I really am looking forward to both of these sessions and the discussions that we may have after these sessions as we go on. I'd also like to welcome Associate Professor Dr. Ilhami, Head of Leadership and Wellbeing Unit at University Malaya, Dr. Sangeetha, founder of Emerging Journey Asia and Yayasan Health and World, and Dr. Edwin, Occupational Health Physician and Country Health Manager of Shell Malaysia, for our panel discussion later. Being open and discussing all, and I mean all, of our mental health issues is the first step to being able to help and support each other in this area. And I'm very pleased that NUMED is being part of this very important initiative and helping to facilitate this openness in Malaysia. The one thing that we all must do is take away the stigma that is attached to the discussion of mental health, both here in Malaysia and still actually in the UK as well. By taking away this stigma, it will mean that people can feel safe and confident in talking about any mental health issues that they have with us as managers and leaders of our organisations. We also need to train our leaders, including myself, in how to recognise mental health issues in our colleagues and students for us as a university, and how we can go about addressing these issues and the cause of these issues. How can we make mental health issues less of an impact? How can we endeavour to stop the things that we're doing cause mental health issues? And that's very important. So finally, just once again, thank you very much for attending today, and I'll hand you back to Shira to take us on. Thank you very much.
Thank you very much, Prof. Baldwin. Next, I'd like to introduce our first plenary speaker, Dr. Norazam Harun. Dr. Norazam is the Director of Hospital Permai, Johor, and he is also the Senior Consultant Geriatric Psychiatrist. Dr. Norazam will be speaking on the implication of COVID-19 crisis on mental health. Over to you, Dr. Norazam.
Can you hear me?
Yes, I can hear you well.
All right, okay. Thanks, Shira, for your kind introduction. And I'm very delighted and honored to be invited for this an important meeting by Newcastle University. And this is my first time being invited by Newcastle University. I hope that I can deliver things which is applicable to most of us, especially during this time, during this pandemic time. Okay, let me share my screen. Can you see it, Shira?
Yes, we can see it.
Yeah. Okay. Yeah. I'm doing a little bit tweaking on this. The title given to me was the implication of the COVID-19 crisis on mental health, but I make it simple. Mental health impact on COVID-19, which is relevant to all of us, and especially during this time in October that we are celebrating World Mental Health Day in Malaysia, which is on 10 of October every year. So this is very relevant to us, especially in the Hospital Permai. I just want to show you, but the implication of COVID-19 pandemic, especially to Malaysia and especially in Johor and Hospital Permai. These are a few a timeline which is important to the healthcare workers and especially to Hospital Permai when we are facing the COVID-19 pandemic. It was started in last year, early last year. Actually, it is in December. I remember that when everybody is taking their leave during the Christmas time, it is on the 26th of December, where not many staff in the hospital and not many people working at that time. So that is the first patient that we identified in Johor. After a group of a family of patient, a family, they went to a holiday in Legoland, and then they developed symptoms, and then we thinking of the infectious disease physician thinking of probably we are dealing with an illness which is similar, has been reported in Wuhan. Subsequently, in January 2020, there is the first Wuhan alert by WHO, and then we have a few other cases following that. Which is in January, 3 more cases reported, which is in Johor Utara, which is in Muar, and of course in JB. And then in February, the first cruise ship, which is on their holiday in the cruise ship, all of the whoever passenger and the crew has been locked down. They cannot board out from their ship, and then we have to swap them, which is happened in February. And first local case, which I mentioned just now, is a foreigners from China who went for a holiday in Legoland. But the first reported cases, which is a local case in Johor, was reported in Tangkak, and we are quite surprised that it happened very quickly. Within 2 or 3 months, we already have this first local cases, which has close contact with another patient. And subsequently, the first reported sporadic case in Johor was reported on the 10th of March. So it is happening unprecedented and unexpectedly very quick, or causing all of us. The COVID-19 has caught us by surprise. I remember when we have a first meeting, the first meeting by JKN, Health Department of Johor. The first meeting was in Permai. At that time, we are like minimizing the effect of COVID-19, saying that probably this is like SARS, or this is like another type of virus, which is like SARS-2, which has affect our Malaysia in 2001 or 2002 at that time. But you see that now the impact of COVID-19 has affected very much away from our thought. So this is quite a surprise to all of us. And we know that the cases has been spreading until on this month. It has surpassed influenza as a leading cause of death to mankind. We see the cases in globally 241 million all over the world. In Malaysia, is 2.2 million has been reported for having COVID-19, and in Johor itself is nearly 200,000, and it has caused death 4.9 million deaths worldwide, and in Malaysia it has causing death for 26,000 reported cases of death. In Johor, it's around 3,000 cases of death caused by COVID-19. And the trend is very quick. From earlier 2020, which is on week 4 and week 6, it's only 8 cases, and it has become to jump to 659 cases in wave 2. Now we are in wave 3, which is from week 19, 2020 up to 2021 now. It's from in week with wave 3 from 5,060 cases last year, but this year it has jumped to 182,000 cases up to now. So this is the wave 1, wave 2, and wave 3, and causing what we call a tsunami of COVID-19. And this is the trending as I mentioned just now. Okay. So most of the distribution in Johor was reported in Johor Bahru itself, because Johor Bahru is quite most populous district in Johor, followed by Kulai, 60%, and Batu Pahat, another 16%. Mostly the transmission was reported cases were from the industry, and it involved many clusters, 100 and nearly 200 clusters, and mostly it's because of industry, and some of them from institution like nursing home, and 27 in the community, and 3 clusters involved the detention center, such as in Kluang, Separengam, and Ulucoh, which is not very far from us. Okay, so most reported cases in Johor was within 20 to 60 age group, and more than 95% reported cases occurred during wave 3, which is starting from September last year until now. And 51, nearly 52% cases occurred among the unvaccinated. 16.4% cases among completed dose 1, and 10% of the cases among the completed dose 2. So the contributing factors which has been identified to cause this spread of COVID-19 in Johor, it is due to interstate and inter-district traveling, especially during festive season. This is the main contributing factors of causing this spread. We haven't in Johor. We are lucky that we are not having any kind of political turmoil, such as in Malacca or in Sabah. So hopefully not in Johor, but hopefully if it has happened, hopefully now the Ministry of Health and Health Department of Johor, they are very much prepared, looking into the experience that they have in Sabah. So another contributing factors is attending masses gatherings, such as in funeral, social gatherings, social activities during this period MCO. Transmission among the hostel residents and workplace. As we know just now, most of the clusters were from industry. The transmission happened in hostel and in workplace, and even in during the transportation of workers from hostel to the workplace. Overcrowding in the van or in the transport, making the transmission of COVID-19 cannot be prevented or unavoidable. And unhealthy workplace environment has been identified as another important contributing factors. We have been educating and giving warning to our staff, especially in the workplace environment. Healthcare workers is an important asset, especially during this pandemic time. So we have been educating our staff not to have dinner or not to have a lunch together, which can cause the spread of the COVID-19, especially in the pantries. So we have giving a stern warning to our staff. Now, if they want to have lunch or they have to have one dinner, only one person at a time. You know, because when they mix together during the tea time or during the dinner or lunch time, they will spend more time talking with each other and very close contact to other people in the pantry. So it is in a like a small place, so which is can cause the transmission of COVID-19 in the workplace. And also the contributing factors, which is happening now because of the Delta variant and the variant of concern, making the challenge of combating COVID-19 is more paramount and more huge. So the plan of action, Permai Hospital has been used for the first COVID ward in Johor, especially when we are helping and working together with Hospital Sultan Aminah, which is as the state hospital in Johor. And you know, Hospital Sultan Aminah, they have very limited places, especially, and there are many other illnesses will be sent to HSA, and they are very concerned about the spreading of COVID-19 to other patients who is non-COVID. So that's why they are looking for other places, and they managed to find a place in Permai, and then we collaborate with them on opening up the first COVID-19 ward in Johor, which is at the end of December 2019, when I mentioned just now, when there's a group of foreigners went for a holiday, and this group of foreigners who are the first patient that we admit them in Hospital Permai. They were admitted in Lavender ward, and now it is not in Lavender only. We have two Lavender A and Lavender B, which can accommodate around 50 or 56, the maximum of 56. Now the whole Iris complex has been turned into to treat category 1 and 2A cases of COVID-19. Not only what our Spark complex has been used also now as a step-down care from the wards, from Lavender or from Iris. If it is a step-down care awaiting for discharge or pre-discharge, they will send to Spark complex. So this is a sacrifice that we have made in order to help our colleague in Hospital Sultan Aminah. Okay, and we have another facility which has been used to admit women and children under 12 years old, which is PKRC, low risk quarantine center for women and children below 12 years old, which can accommodate 535 beds. So this is all has been in the hospital, Permai Hospital compound. So we have to be aware of the victim of COVID-19 is not only the index case, but it can affect those who are very close to them. Like say, example, family members. And so this is the categories of victim. So the index as a primary victim, the secondary victim, or the second level of victim is family members and the close friends who are very close to them. So these are the victims, category of victims. The third level of victims, those who are emergency and rescue personnel, such as the healthcare workers, the police office, the police and the all the rescue personnel who has been helping as a frontliners. So they are also victims. So we have to take care of them, not only the case, not only the family members. We have to take care of the healthcare workers and the other personnel, military, police, and fire brigade personnel. So we have to ask them about their how are they coping with this kind of pandemic. Okay, those who are under the first level of victims are the members of the community who offer help. Our neighbors, sometimes they are very concerned how to offer help to this to the family who has been affected by COVID-19. They are also affected. Probably they have fear. Probably they have negative perception, stigma as such. So this is they are also categories of victim that we have to take care, or we have to ask about their mental health. Number 5 is those affected indirectly, especially those our family members who are far away from us, or friends who are far away from us, who cannot cross the street, who cannot travel interstate, only by calling a phone calls only. They are also affected because they feel worried. What happened? What happening to their children who has been who are affected by COVID-19, probably in the college or university, who has been locked down in the university. How are they going to survive? Who are preparing their meal for them, etc. So the parents or the other family members who are away and not directly close contact with the victim, they are also affected. And those by chance get involved. So this is another categories of victim that we have to keep in mind, that they are not only the person itself, but we have to think in a broader categories. Okay. So the JKN health department has created a few initiatives. FTTIS, for example, find, trace, contact, test them if they are having symptoms, isolate and support strategy, FTTIS. Okay, they have done risk management, risk assessment to the clusters, risk reduction by isolating and not mixing those who are having symptoms and not having symptoms, and risk communication with all the other agencies which have involved in the pandemic COVID-19. Because of the difficulty to see patient face to face, health department also, especially from the NCD, non-communicable disease division, they have come up with an initiative of having QR code for the Saringan Minda Sehat. This is for the by using QR DAS, which is depression, anxiety, and stress scale that they have converted into the in a QR in a QR format, and then they can answer the victim or the patient or the family members can answer how are they coping with COVID-19 now. Okay. Apart from that, they have state of Johor also have been providing phone consultation, telecounseling for those who are in the low risk quarantine center or in the ward, by giving helpline to those who are involved, to those who are affected. So if they need counseling or they need advice on what to do, they need more information, they can call the numbers. Okay. So as we know, the long-term impact of COVID-19 on mental health, it can be physical, it can be psychological, it can be social, and it can affect us spiritually. Of course, when this is the COVID-19 is this experience is a little bit is unique, that we have to distance ourselves from other people. So the effect of social distancing is very much affect all of us, because we need someone to be close to us. We are social animal, so we need someone to be close to us. So because of the social distancing, we cannot meet up with our parents, we cannot meet up with our friends, we cannot drink, having tea or having coffee with our colleague during lunch. So this is all affecting all of us. And then we need to adopt this behavior. Or even though we have vaccinated, we have done our vaccination, dose 1, dose 2. So, but still we need to have the external protection, not only internal protection, also the external protection, which is wearing mask, face shield, keep our distance, having cough etiquette. So this is we have to adopt this as a new norm, especially like this. The conferences that now is more online. Okay, so this is a new norm for all of us, affecting all of us, including those who are in the school children, in the office. They cannot go to work. They can work from home. We encourage them to work from home, especially those who are working in the office as the administrator. The clinician, they have no choice, but they have to see patient. But those who are in the offices, they can bring their work at home. So sometimes this is quite confusing to them, because they have to work sometimes not according to the time schedule from 9 to 5, but because of they have to work from home. So sometimes they have to work overtime. This is causing sometimes affecting our colleague, our workers as well. So the patient itself, they have difficulty to come for follow-up, affecting their existing illness, let's say hypertension, diabetes, because they couldn't go out, or there's no one to accompany them, like children, to bring them to hospital, causing them to have defaulting their medicine. So this is causing fast deterioration of their existing illness. And of course, the long-term effect of COVID-19 is the long COVID-19 illnesses itself. Brain fog, sometimes those who have been affected by COVID-19, especially those who has been intubated, so they have difficulty with their concentration, focusing, with their memories, and even with their anxiety symptoms. So psychological effect, of course, all of these causing fear, causing anxiety, depression, hopelessness, all this affecting most of the COVID-19. I will share with you a research that we have done in Hospital Permai. Okay? Of course, the social effect, many of them lost their job. Okay? They have to change their job from being a steward or stewardess, being a pilot. They cannot travel anymore. They cannot work anymore. They have to change their job, work as grab food delivery, etc., which is demotivating to most of them. Okay, and socially, if they are the places has been locked down, so supplies of the errands sometimes has been affected. This is all in the social impact of COVID-19. And the loneliness, which has mentioned as well, because of the effect of social distancing, many people experience loneliness, especially the elderly. They experience loneliness more than any other people, because now their family members, the children, cannot come back to see them. So they experiencing loneliness. Okay, and more time for the youngsters. They more time on the social media and the computer. There are increased reported cyberbullying in the during this pandemic time. And spiritually, of course, some of them, they feel guilt that they have sinful thinking. This because of my past sins, that God has given me this virus. Okay, and it has been reported increased domestic violence. This data from the hospital Selayang, and increase in wave 1, especially in wave 2, 19 cases has been reported for domestic violence in hospital Selayang. Okay, this is reported by police on the number of suicide. From 2019, it was 609, and in 2020, it has gone up to 631, and this year up to July, it has gone up to 638. Okay. Well, we worry about this suicide, and it has been reported that suicidal acts among the adolescents as the impact of COVID-19, either is directly or indirectly, it has increased in 2019, 2020. Okay. I want to share with you a simple study that we have done among the it's a stabilized patient in 4 hospitals in Malaysia, including Hospital Permai. The study site were in Sungai Buloh, Selangor, Hospital Kuala Lumpur, in our hospital, and in Maib Serdang, low risk quarantine center in Serdang. The study period was in April last year. It is 2 months. Okay, from 15th of April to 30th of June 2020. And the total number of subjects was 401 with a good response rate. And we use a few instrument tools to detect mental illness and how they cope. Okay. By PHQ-9 for depression, GAD 7 for anxiety, and brief cope tools for how they cope. Okay. From the result that we have done, depression among these 4 multi-center, depression was detected around 7.5% of the patient who is suffering from COVID-19, but they are stable. Okay. With the PHQ-9 mean is around 3. Okay. Many of them having mild to moderate, around 20% of them having severity, 20% of them having mild to moderate severity, and 3% having severe depression. And anxiety, 7% develop anxiety during their hospitalization and during their admission. And majority of them having mild to moderate anxiety, and 2% having severe anxiety. And 4% of those who are admitted to hospital, the 4% having suicidal ideas. This the details of this result was the respondent was many female, more than male. The age of 35 to 49 years old. Chinese, more than Malay and more than Indian. Single, experience more depression and anxiety, and those who are unemployed has been very much affected by this. And the study showed that Malaysian is very much affected by this rather than our the non-Malaysian. Surprisingly, the top 20 socio-economic class, they are much more affected rather than the middle 40 and B40, below 40 of Malaysian population. So how do they cope? These are the 5 top coping strategies by our Malaysian who has been affected by COVID-19 in the 4 hospitals that I mentioned. Many of them use religion as coping strategies, followed by acceptance and positive reframing, saying that it's only the illness itself. And this is positive reframing. And planning, followed by planning, how they plan after they want to discharge from hospital. Do they have any plans or not? And they cope through emotional support. Okay, these are the 5 top coping strategies from our study. And how about the maladaptive coping? Okay. Self-distraction, okay. Meaning that they are thinking too much about everything. They couldn't focus. They couldn't focus on the illness. Just thinking about their family members, who's going to look after their children, who's going to look after their family when they are admitted. So these are maladaptive coping for majority of them, causing them to have anxiety and depression. Venting emotions such as in an appropriate way, in inappropriate way. Example, venting anger towards their spouse, towards their children. Okay? Denial is another maladaptive coping. Denying that, saying that COVID-19 is not real. COVID-19 is a make-up story by Jews, by other group, Illuminati, example, etc. Self-blame is another maladaptive coping by Malaysian. Self-blame, this is my fault. I have too many sins. Okay, this is self-blame. And behavior disengagement. When we give some tasks for them, they tend to disengage with the advice and with that we have given them, okay? Such as following SOP. They refuse to follow SOP. This is maladaptive coping. They said, if I use mask also, I will get COVID-19. So what's the purpose of wearing mask? So this is kind of behavior. This is a kind of maladaptive coping. And I have to mention, I went to it's already 5 substance use has been, it is number 6 already, number 6, 0.09, they are using substance to reduce the anxiety, to reduce the depression as a way of coping, which is the using of substance can be a maladaptive coping for some people. So the contributing factors, okay. For this, for the stress or for the anxiety and depression they are having, is what are the contributing factors? 52% feel that all of this because of the infection, the fear of infection. That's why they develop anxiety. That's why they develop depression. Discrimination from society. When the family has been affected by the COVID-19, they try to hide it from the other society because of the discrimination from other people, especially neighbors. But they couldn't hide it. When the hospital ambulance came to fetch them to the hospital, everyone knows that the family is affected by COVID. That's why when the personnel, the healthcare workers come with the ambulance, they're wearing full PPE. So they cannot hide. That's why the family members who is left behind at home has been discriminated by the society. And then this is causing 43%, 44% having the symptom anxiety, depression for the patient. Okay. And of course, the financial burden, 40.9% said that financial burden causing them to have more anxiety, more depression, and lack of information from the government, from the authority. What next? Uncertainties, or lack of information, or wrong information. This contributing to anxiety and depression among our patient. All right. So prevention, I won't talk about this so much because I think the other speaker will talk about this as the title of our conference today, about resilience. So we're just aware that resilience can be from internal and external. We cannot say much about the internal, more on the external, how we cope with COVID-19. Are we having a optimism, a good cognitive restructuring, looking into how the illness is affecting us, how we express our emotion, how we control our emotion, and social skill, the social support. Also, this is all affecting our resilience. Okay? And we develop a healthy habits. Continue with our physical exercise, but following SOP. Not many people are running together. No, okay, one person can run in their neighborhood. Okay, adequate rest. Do not think too much. Okay? When it's time to rest and sleep, you're gonna go and have a rest and sleep. Okay? Take the nutrition, your diet properly. Okay, do not take one diet, but in particular, like example, eating too much chocolate at home when no one notice because they cannot go out. Okay? So this is sometimes can be hazardous to a person. Okay, and then we have to identify, especially deal with the maladaptive coping, such as using substance, smoking too much, too many cigarettes. Example, okay, drinking too much at home because no one monitor. Example, so this is all maladaptive coping that a person have to acknowledge. This is causing a bad habit to them. Okay, as I mentioned just now, this is all right. So this, even though now the cases has gone down, so we have to be always be prepared, because what our DG Tan Sri Dato Sri Dr. Norazam always mentioned to us, that success breeds complacency. Okay, and complacency breeds failure. He always remind us and advise us, do not let our guts down, even though the number of cases has gone down now. Okay, everyone has to get vaccinated, especially those who are healthcare workers dealing with patients, dealing with public. Teachers have to go get vaccinated. Okay, periodic self-testing, especially when we are having symptoms, so we can do test kit. We can buy a test kit and then test it ourselves, even by using the saliva or by using swab tests. We can do it ourselves and comply to all public health measures. Comply the SOP. Okay, even though we are already vaccinated, but we have to use mask. We have to wear mask. We have to wear face shield if we are dealing with a patient, and having practice proper right cough etiquette. All right. So as I mentioned, also this month, October is in conjunction with World Mental Health Day 2021, and it is we have been celebrating that. Also, Permai will have a webinar on 24th, which is this Sunday. We will be celebrating and in a virtual way. All right. Okay. Thank you very much for listening, and I'm sorry a little bit more than the time has been. Okay, back to you, Shira.
Thank you very much, Dr. Norazam, for the very informative presentation, and thank you for taking the time to join us today. Next, I am delighted to introduce our second plenary speaker, Dato Aliyah Karen. Dato Aliyah is a social entrepreneur and activist with over 20 years experience in hospital administration and management as a CEO. Dato Aliyah is the founder of AKRAB, a social enterprise that focuses on building better futures for the communities by nurturing and developing lives. She is also a founding chairperson of Yayasan Health on World. Dato Aliyah will be delivering her speech on molding the future of workplace mental health in Malaysia. Let's welcome Dato Aliyah Karen.
Hi, thank you, Shira. Hi, everyone, and very good evening. Thank you for joining us, and thank you for joining me, and also a special thanks to Newcastle University Medicine Malaysia. I was glad to hear the opening where the CEO himself, Professor Christopher Baldwin, saying to have open conversations, something that I have been talking about ever since the pandemic hit, and many were asking and are in a dilemma right up till today. So having said that, I choose to share this report as a start. I've been reading quite a lot of surveys and reports and research work done because I cover from a management point of view. My background is in management, HR and management. So I've been covering a lot of companies for the last 15 months ever since the pandemic, thus a lot of reading. But I felt that I wanted to share this report, at least a couple of pages here, simply because it resonated well with the audience. I'm thinking that since the audience are merely within the age ranges of early 20s right up to 40 years old, and in the working industry for probably 1 to 3 years. If you are a med student, then you would probably definitely fall into that category of the ages there anyway. So let me share with you as we go along. I have made some comments on the report. So Shira, if you're sharing the report, somebody, can you flick the pages, please? Next. Right. So generally the report, I hope you could see the screen. Generally, you will see 56% of these are actually working in the same field where they graduated. But I'm focusing merely on the age group of 60% of them falling into the category as mentioned just now, 25 to 40 years of age, and having the experience of working between 1 to 3 years. So 30% of them are actually having the work experience of 1 to 3 years. Now, the report was done by WOBB. I will explain to you WOBB are. They are basically a digital company going into digitalization. They deal with employers to find the right employees, and they are basically the higher end of the jobs, the people on job street, or the regular people offering job spaces and job functions for newcomers into the industry. So if you want to change jobs and things like that, they are basically doing a portal, they are doing online, and they also have face-to-face. So they did a survey, which I found was very interesting, and let's see what the survey says, because this is the latest, coming out just a couple of months ago. Next, please. Right, when it came to employee satisfaction, next, I wasn't very surprised to see that 69% of the respondents actually worked during the MCO. Now I'm going to get your focus towards the 31% not working, and I will come back to you on why they were not working, right? Because the focus is now on the 69%, and from that percentage, it was interesting to see that despite a lot of hoo-ha out there in the industry about having a pay reduction and losing their jobs, out of the 69%, 69% of those from the 69% had no changes in their salary. 27% had a reduction in the salary, and in fact 4% of the 69% actually had an increase. What's interesting is, next slide please. What's interesting is, if you look at the 32% reported that they actually had to work more hours. So that could have been the contribution of the increase in salary, or that could have been the contribution with no salary deduction, but you end up working longer hours. And the highest rate there, I don't think you can see, but basically what I've circled there is the word stress. So they found that with working longer hours, the 32% of them were really stressed. So you will see the other categories of either were they happy, or were they satisfied, or were they angry, and so forth. Next please. Right, we talked about remote working experience. We will be talking about remote working in the next 30 minutes or so, because I will explain to you why again I do say that. Now, based on this report that they did, 75% of them actually were working remotely. And for those who are working remotely, only 25% of them did not work remotely, and 75%. Now, out of that 75%, after MCO, 71% still continued to work remotely. So obviously, what I'm trying to say here is the trend is going towards either hybrid, or we will continue working from home, or we will continue working with flexi hours. So as much as it may not be something that employers are keen to dabble with to start off, but I think this is the way it's going to go, and I think some sort of acceptance need to come in, and we will be discussing these few factors later on. Next, please. Now, 37% reported that their work-life balance got worse. So in the first place, having spoken to many industries, companies, pharma companies, business entrepreneurs, the past 18 months, I am one person who do not believe that there is such a thing called a work-life balance. I think work-life balance resonates well with people who are doing a desk job 9 to 5 on the level of an administration or fixed jobs. Otherwise, I don't see the management, leadership, those who are having roles, bigger roles to play, having a very this work-life balance. Of course, you can inject a lot of things to ensure that you are mentally, emotionally, and physically resilient and stronger. But to pin it on the head to say that there is a work-life balance and I'm practicing a work-life balance is really a question mark there as far as I'm concerned. So 37% of those who are working actually found that they did not have a work-life balance, and in fact it got worse. It got worse because they were working from home, and thus I think you have heard a lot of them saying about the longer hours and they put in. And again, there's this issue called a trust issue, which is why probably this has happened. Next slide, please. Right, I would like to bring your attention to this interesting thing where we talked about the work experience of respondents who work during the MCO. Again, we're talking about 53% of the respondents they did not see any change in the relationship, but 35% reported disconnection. So prodding a little bit further and reading the report and few other reports, it was generally the types of organizations that practiced good culture, that practiced good behavior, that practiced good leadership, that managed to be in that 53% range. Whereas you found that those who were either lost or who were neglecting certain things which were very important to employee-employer engagement, they fell into that category of 35% where the disconnection happened. So what will we do about the disconnection? We will be talking about that as I share some slides with you. Next, please. Right, I think basically this one is about the positivity, current employment satisfaction. So 63% of them, the employers, practiced positivity, whereas the rest did not. But out of the 63% positivity, 20% were very, very optimistic. And I think the word optimism is something that we want to hold on as we move forward in these unprecedented times, and times where we do not know what is going to happen and what kind of change is going to take place. All we can do is be optimistic, be realistic, and hold on to the things that we know will work, and let go of the things that we know we have no control over. Next, please. Right, this is about, again, the employment satisfaction, and this is where the 31% of the unemployment, which we talked about in slide 1. So 31% of them were unemployed during the MCO. Unemployed meaning not that they did not have a job. They had been working prior to that. During the MCO, they were either let go or they were retrenched, and you can see a large pool there. Almost 50% of them were actually retrenched. The others were obviously the companies shut down, or they had to resign, forced to resign, or took the voluntary scheme. Next, please. Yes, this is something that I spent quite a bit of time. I wanted to see the shift, the change, as I advise companies. I wanted to see the shift in pre-MCO and during and post-MCO. So if we turn the clock back even 3 years back, and we talk about employment, we're actually talking about salary satisfaction. We're talking about career growth. Now these two did not change. Talking about when we come to post, which is either currently or we're talking about in future, for employers and employees, there's no change in terms of what are the factors ensuring that they stay valuable in a company. They're still holding on to what's important to them, which are the two main shifts, which is salary and career growth. Now, the shift was at the company benefits, which moved up, job security, which moved up. So obviously there was a lot of fear, there's a lot of unsettling issues, and there are a lot of question marks of where would they go with the company. And the company culture went down. So company culture, as much as many people want to focus and are keen on talking about company culture, I myself decided to put the company culture a little bit on the back end, simply because I realized that employees were not really very interested in the culture of the company anymore. They wanted assurance and security, which came in the form of job security or company benefits, because they knew company benefits were not monetary, not necessarily in the form of dollars and cents. If you look at the one below, again, when we find that they did a further research for those ages 25 to 56. So they were very, very specific. And again, you would find the shift there, no longer the career growth for those. That means they have a little bit of more stability where they were working in terms of their work. And besides the salary which they wanted, company benefits and job security stood second and third. So naturally, all those people who forgot company benefits, it's about time that everyone thought about company benefits at this moment, because the survey is there. And I think Ernst & Young did a survey, similar survey. You can read it online, dated July 2021. They did a pretty fantastic survey as well on hybrid, on post-COVID, and also the future of job placement, job market, and employee satisfaction. Next, please. This is benefits that the employees look for in a company. So interestingly, obviously COVID is very medical related. So everyone was very concerned, will they be covered, knowing how expensive it is in the event that you do fall sick. So medical coverage, flexibility of working hours. E&Y covered this as well to say that flexibility, everyone wanted flexibility in working hours. In fact, 7 out of 10 people that they interviewed, companies as employees, wanted flexible working hours. Now again, the change shift there you would see on the numbers 4, 5, 6, the ones that are in mauve, purple and pink, where you find they preferred remote working. They wanted a higher number of annual leave to spend with their family, obviously, or on a holiday, etc. And surprisingly, coming somewhere on the number 6 was casual work attire. So people started to note that the past 18 months, I think all of us are guilty to it, where we did not need really to dress up and get ourselves spick and span, wearing the best clothes to work, or rather our working attire. We could stay at home, be equally, if not more resourceful, more reliable, and still going about what we need to do, being dressed down basically, and going a little bit more casual. So why were we in the first place having very, very formal attire on a daily basis, not as and when needed in the company? Next, please. Yeah, that's the last slide that I have on the WOBB survey, but I will continue to share personal slides. Can I start sharing my slides, please? Okay, let me go here. Okay. Right, I'm covering molding the future of workplace and mental health. So therefore, mental health simply because obviously my counterpart, Dr. Sangeeta, is on the panel later on, and I'm sure she will give you a little bit more insights, more towards counseling and mental health. I am barely covering from the perspective of a layman in terms of whether you are a boss of the company or an employee. With my background in management and a CEO of a company from corporate to a non-profit in a corporate organization, a public listed company, I deal both with corporate as well as the non-profit. Having said that, last year I took a back seat and not knowing it was COVID, obviously, I decided to quit after 2 decades. And when COVID hit, I was sourced to be advisory for many of the companies for workplace. I did a lot of employer-employee benefits and employer-employee changes. And this continues to today. So what I'm going to share with you is basically what I found works, the trial and errors. Naturally, there was a lot of pivoting to do, a lot of changes that needed to be done, a lot of testing. And I'm glad to say that after 18 months, what I'm going to share with you is basically what has worked and what I believe will work. Obviously, I'm not going to put a mark there and say it's 100%, but I'm going to say using your own tools. I'm going to tell you how to use your own tools and how you're going to use your own resources to maneuver around what will work. So as mentioned just now, WOBB, they are basically the job search, and their focus is on employers searching for a job platform that focuses on effective hiring and company culture to best fit with potential employers. Okay, so saving time for everyone. So that is basically I have sent in the WOBB, so anyone who would like to have a copy of if you don't want it online, you want it sent to you, please reach out to the people behind the scenes, and I'm sure our friends here will be happy to email a copy to you. Right, so when we talk about molding the future of a workplace, I have actually divided this into 3 categories because I'm looking at it from a holistic point of view of the main or the key people, where you find naturally in any organization, you have the CEO, the big bosses, the CEO, the COO, the owners of the company, the shareholders or the stakeholders, business directors, basically the cream of the crop, the people who make the decisions, the people who own the companies, the people who are the biggest stakeholders in the company. Then we have the mid-management, or the HODs, right? So the head of departments, the mid-management, the managers. Now you handle the bulk of the staff and you handle the day-to-day operations. So you are the sandwich. Like the sandwich, you are smack right in between the upper management, and you have got employees, below you, subordinates and employees who actually report to you. Then you have at the end of the trunk there, you will see employees. So most of us either fall into one of these categories. So I will start with the employers first, since they seem to be the cream of the crop. Now we're talking about mental health here, and we're talking about the workforce. I'm glad to know, I think if there's one good thing, a few good things came out of the COVID-19, obviously, but one good thing is that more people are actually discussing mental health. Why more people are discussing mental health? Simply because many people were affected. Their mental health and stability were affected with the sudden tsunami, the sudden storm of what we call the COVID-19, which not only was unprecedented, but simply something that none of us had ever dealt with. And we're not just talking on a very small scale here, we're talking about the worldwide, global scale here, where everyone was lost. And again, it was from March 2020 Everyone was on lockdown, and we had to try and do so many things. But the people who were really affected, although I would say the mainstream, everyone was affected, but the people who were actually affected were two categories: the employers and the employees. Simply because we're talking about finances here, we're talking about financial stability, we're talking about livelihood, we're talking about the economy of the country, right? So we had this, and one few things that I would like to point out, which is not being discussed by many people out there. You will find that there are keywords that I put in that I'm hoping maybe Newcastle University would take this on as a beginning, as the beginner. Is I'm just wondering, and I've been proposing to heads of companies to re-look into your mission, vision, goals, and objectives. Why I am asking you to do that is simply because I'm looking at whether your mission, vision, goals, and objective have changed. I know of two companies that I'm assisting at this moment who have changed, maybe not the vision and mission, but the goals and objectives. Why? Is because if you have not changed your mission, vision, goals, and objectives, then I think you're still very old school, because you understand that the past 18 months, it has shifted, and we are not going to go back to where normal was. We are actually moving forward. So many employers have forgotten to change the goals, the vision, or the mission, or the objective. Previously, when we talk about the mission, it is what we want to achieve now. Now we have, how is it we're going to achieve this mission now, because we have so many obstacles in our way. We talk about vision long term, and you may have made plans for a 10-year goal. Unfortunately, the 10-year goal is not going to happen now, again, because of a lot of restrictions, right? And the objective. So again, are we going to change? Relook and see where do you want to change. And this change should be mentioned throughout the organization. I will reiterate the word here again: open, honest conversations. Okay, so for employers, my encouragement and my advice is to have open, honest conversations, to have town halls at least once a month. Now, addressing the employees is crucial and critical, and being honest and open to them only tells your employees that you are actually communicating with them, being honest, telling them, and if they need to take a pay cut, if there are changes in the organization, if the organization is stranded, or temporarily, even if there is a halt, they are aware about it, rather than they hear it from others who may not have the real story. Remember, the story in an employment, in an industry, in an entrepreneurship, in a company, in a business, even in a university, starts from the top. Because the vision, mission doesn't go bottom up, it comes top down. So naturally, we need open, honest conversations, top down. Now, I think you do not see the entire group of employees. So check in with your seniors and have these conversations, because whatever you say to your seniors, how you motivate your seniors, or how you tell them the story of the changes, things that are about to happen, what are the next steps that you're going to take, what are you looking into, anything, are you guys going to pivot and make changes? Are you moving towards something new? Are you dropping something that you used to do? These are the conversations that the seniors will then have with their employees. Provide a safe platform. Now, one of the things that I think Dr. Sangeeta is with me on this same thing, that we talked about this from the middle of last year. A lot of blame game. When I first started talking to employers and employees, I heard a lot of blame game. Employers were saying how employees did not understand the predicament that they were in, did not empathize with them, that they were losing money, losing business, cursed and swear that they saw that they needed to either shut down, or they needed to do things on a smaller scale, even cut for the matter of salary deduction, letting people go. So there was a lot of blame game there. And employees on the other employees on the other hand were also blaming, saying they were victims. This is, you know, the proof. When you look at the human resources ministry, you will find the number of complaints employees have put over employers ranged at 1 month there was something like 14,000 complaints in 1 month. So it tells you that the employees were not getting answers or felt that they were victimized. So I think the counseling, when I talk about counseling, I'm talking about a safe platform here, bringing an outsider in. I'm not talking about HR doing counseling. Please take note that that is the last thing that you want to do, because honestly, to the employers, my advice out there is they are not going to trust your HR. They are not going to trust your leaders. They are not going to trust the people they work with. Simply because of private and confidential matters, they are not going to let themselves go. Neither are they going to share anything that they are going through, because they are afraid that whatever they say to you is going to be heard by the rest of the people indirectly. And so my suggestion is, actually, you are having many rooms, and now with everyone working either remotely or you are working at a 30%, 60%, maybe 70% capacity. Worst case scenario, even if you're telling me you're going to work at 100% capacity, I'm sure you can find a room where you can name the room as a counseling room or a safe space. Call it the safe space. So one of the things that the employee can give in order to shut everyone up is to say, that is your safe space and we are inviting a counselor in. So whether it's once a month, whether it's 3 weeks once or every fortnight, a counselor comes in and actually gives the time to the employees. I salute employers who actually do that, because they are giving a platform and they cannot be faulted for not being fair to employees. Don't forget, when we talk about mental resilience, we also have emotional resilience to look at. So it's not just the mental that we are talking about, right? So we also have the emotional resilience and the emotional understanding, the emotional comfort that staffs need, and that is something that is often forgotten. One of the things that the employee can do is to set aside a benefit budget. The statistics just now and the research clearly shows, whether you look at the EY research, you look at, there's another research from Thomas, where you can get the copy for free if you email them. They have also done a research, or you look at WBB's research, you will find that employee benefits is something that employees are now looking into, right? So my suggestion has always been to relook into non-monetary benefits, right? For example, you can promote all sorts of well-being activities, even from the form of whether it's listening, whether it's a form of having avenues, tea sessions, coffee, lunch, things like that, where it doesn't or would not cost you much. Now, employee benefit package, benefit budget could also include simple things like vouchers, simple things like have a cup of coffee, you just want a cup of coffee with the CEO, have a cup of coffee, or lunch is treated by the CEO. So if you have never had the opportunity of having lunch or coffee or a session with the senior management, this will be a good time to actually get them to do that, because it really is not in a monetary form, right? And I think employers need to understand that feedback is crucial. Not just employers, I have put feedback onto all the categories, simply because feedback is something that we all need. My advice initially did not go down very well at the beginning of COVID to a few companies. But looking at it now, I will tell you that I have 100% of the companies that I deal with telling me what I said last year is actually very true. Now, we all have set KPIs. We have heard about performance indexes. We have heard about assessments, and you have done all this previously. My advice to you is to park all these aside, because of all the changes that have been happening. That is not the most important thing to evaluate staff with this predicament that we are all in. With all the changes, if you are still using KPI, you're still using the same form 3 years ago to see how your staff is performing, I honestly think you should reconsider this. So park aside the KPIs. It's not about the KPIs. It is about the employee's performance, given the fact, the situation, the circumstances that they are in. Is the job met? Is the work done? Is there job satisfaction? Is the output the outcome? And at the end of the day, my two words that I hold on to for the past 2 decades is this word: end result. Is the end result met? Are the end results met? I think that's more important than filling a form saying you got 73%, you scored 84%, you scored 30. I don't see how relevant the percentage is if we talk about those who have been working from home, those who have been having to change, those who had to switch, multitask. It's really difficult to make an assessment. Last but not least, to employers, please remain empathetic. I think empathy is the key word here. And if you can't remain optimistic and you keep blaming to say, the government is this, there's instability, we do not know, the economy is unpredictable, then no one has the foresight, because it starts with you being optimistic. I think you being optimistic gives some form of, takes the pressure off your employees and actually gives some form of comfort to your employees. Now, let's go to, I think the bulk of the people would probably fall into the management and head of departments. So if you're a manager, you're a senior exec, as long as you got a staff below you reporting to you, then it's your responsibility. We have all heard of this word check-in, right? So recently, whether it is counselors, whether it's psychiatrists, whether it's psychologists, everyone's using the word check-in, and it's a good word. It's something that we never used to do because we took things for granted that we would see people on a daily basis in the office at least 5 times a week. Today, we need to check in because everyone is in their own homes or working from home, or even if they do come in, they are not coming in on a very regular basis, and things have changed. So there's no harm, and my suggestion would be to check in, narrowing down on how they are coping with projects and assignments. Now, I said this, I think, a week ago to a group of doctors when I had a session with them. And I said, we like to ask the question, how are you? Now, that's a very general question. What do you expect your employees to answer? If they say, fine, it's a very general statement. Fine doesn't define much. And if they say anything else, it may show their weakness, or it may show that, are you actually really wanting to know what's going on with me or otherwise? So when you have employees and when you check in, please be specific, asking them how are they coping. How are they coping with their project assignment? So be specific. How are you coping with the survey I asked you to do? How are you coping with your sales figure? How are you coping with, the branding exercise that we talked about? Be realistic, and also note that there are changes to be made. There were changes that are happening, and there are going to be future changes. So I think we got to be realistic, especially if you're running last year's programs. I know of a company who picked up recently, the past 2 months, and the head of the general manager actually said, okay, this is what we were in the plan for 2021. We are already delayed, so let's push the plan and try and catch up. And I was saying in the discussion, I don't see how you want to catch up a plan that you planned prior to COVID for 2021 now, unless you're oblivious to the changes that's happening around you, that you actually think that the employees are going to carry out the set plan, although there has been so much of changes. We're not just talking about COVID, we're talking about mental changes, emotional changes, acceptance, the fear of work. We're talking about a lot of things here that has happened over the 18 months. You can't push those things under the carpet, right? So one of the other things that I'll tell you is not to ignore the signs. Now, there are trigger signs. I use the word trigger because many of us we are not sensitive towards signs of our employees. So don't ignore the signs of if they are sad or they are anxious or they are troubled or they are struggling. Now, not everything can be solved. You can't solve every single thing, neither can you say, okay, I'm going to listen to you and be able to solve your problem. So there must be pockets or compartments of what you can solve and what you can't solve. So for example, if they are troubled and something to do with work, naturally you can give a helping hand. But if they are anxious about the wife losing her job, or there is going to be an announcement next week and there is going to be a pay cut, or a child is sick at home, or their parents have got COVID, or some sort of struggles financially, emotionally, then it is only fair that you find them the right people to assist them. But look out for these signs, because that's the least you can do as a manager. Don't forget to promote well-being. Today, well-being is free. We are all open and we can go out and have activities. You can do walking, you can do cycling, you can go out and meet people. So healthy lifestyle, right? So you can promote well-being. I think from top to bottom and bottom to top, we need to promote well-being, because there's a shift, and COVID was actually a health issue. It was a health-related issue, and our immunity system at one point was talked about on a very large scale, that everyone was pumping in vitamin C's, everyone was pumping in whatever they could, saying that it was COVID resistance. Now, obviously, we know better, but nevertheless, well-being plays an important role, simply because it is a total overall holistic well-being, mind, body, and soul. For managers and middle management, my suggestion is please look into these simple things which many companies have started. I know the companies that I assist, or the people that I assist, that I speak to, whether it's even if it's a small industry, they have started this thing called a weekly tea session, right? So it's either 3:30 to 4:30, even if it's for half an hour, where there's a break and you are able to talk about other things in that break. Indirectly, you will then start looking out for signs even during these breaks. Lunch and learn is something that if you have flexi hours, then use that lunch where everybody is having lunch while learning about something new. Some statistics that have just come out, something that's happening in the industry, changes, the economic scale, budget 2022, anything, right? And you also can do tea talks where you get in people, you invite people, and I think between Dr. Sangeeta and I, we have been going into many of these sessions. People have been inviting to give talks. And again, I think it's all of us. It's just not anybody, including me. I think I'm guilty as charged here as well. We always want to listen to new people talking about things. We do not want to listen to the same people we work with talking about anything. We tend to pick things up when it's a new person or a person that we do not know, somebody from outside the industry talking, and we are very, very focused. Games, I think statistics, companies, if you read a lot of reports, even from WHO related to UNICEF, I think, if I'm not, or UNDP, they did talk about bi-weekly games, right? And one of the things that I'm encouraging everyone to do is the appreciation board. Now, this is free. The appreciation board is simply because we have lost track of seeing face to face, and we have forgotten the simple word of appreciation. So from thank you notes to emails on the job well done to mood boosters, I think these are all very, very good to do. It helps to build the community spirit in your organization. I would focus on this word here, mentoring. Simply because every Friday nights, together, about 30 of us, we actually do a mentoring session every Friday night called Prime, under this umbrella called Prime for Success. Now, it's free. There are lots of other sessions, mentoring sessions that are going on. Some universities are also providing. When I talk about mentoring sessions, I'm referring to there are 30 of us who specialize in various industries, right? So we have from scientists from Kazana right down to HR people, we have lecturers, we have people who are bankers from oil and gas, etc., etc. Now, the 30 of us come together every Friday night offering free mentoring services to university students, fresh graduates, and those who have just come into the working world, probably 1 to 3 years. So if you are keen on getting a mentor and you switch, you don't have a specific mentor. So every week you will be getting new mentors. So obviously this is something that the management or HODs can provide externally because it's free. So just relate this and say to all staff who are going through some phase or other, say, I insist that you go sign up for this mentoring, because when they are in this session, they are more open. They listen, they ask, and they learn from industry mentors. And they understand the working culture better. Again, I will use the word, please have empathy, confidentiality, and feedback is important. Now, last but not least, for employees, right? So now, lots of grants. I think we were facing a lot of questions, unsettling thoughts last year. This year seemed to be a little bit better, especially the past 6 months, because initially everyone was thrown off, especially employees. So to employees out there, if you're an employee, you have to be responsible for yourself. I think this blame game needs to stop, right? So you have to do self-checks, because your body is your body. You cannot blame it on anyone else. If you need help, seek for help. There are so many avenues giving free assistance, or even assistance even if you can be referred to, or even if it's for minimal cost or by donation, whatever it is. There are many people out there who are willing to help. It is for you to take onus. The onus is on you to be responsible and seek for help. So you got to start taking care of yourself, and you got to start appreciating and understanding that it's not about you. The world is not revolving around you. So you got to start understanding what is this whole thing about, and the shift that has happened, the changes that has been made. It's not just involving you. It involves the management, it involves the industry, it involves the entire world. Right? And you got to appreciate what you have rather than seeing what you have lost or what you do not have. So generally, to everyone out there, we need to reset. It's back to square one button, where you reset, you readjust, you restart, you refocus, you relearn, you evolve and change. You got to be agile, right? And then that's what I say. When I say that, I mean you got to be smarter all around. So if you understand what's going on, you can accept what is happening and make the necessary changes. Be agile and learn to change. If you need to refocus. You need to restart. You need to relearn. You will relearn. You will be smarter to adapt. Then it's so much better, rather than wait and play the blame game of blaming everyone else because you needed to take a pay cut, because you are not going to get bonus, because you cannot go on a holiday, etc., etc. Give constructive feedback. I think, again, feedback is very important regardless of whether you're employer, mid-management, or employees. Give constructive feedback. Now, the keynote to remember before I end my presentation is this. Please remember that the world is getting tougher, so we need to be smarter. I think that's a very known fact, right? And I think it's enough of debate. I tell this to all companies that I go in, all the bosses, all the employers and employees, enough of debate. No need to debate. There is no need for a debate how it's going to be. When people ask me all the time, are you predicting in 2022 that we will be back to normal? Do you think the economy will pick up in 2023? Do you think everybody wants to go back to work? I think there is enough of it. I think you just need to be ready and be realistic. If you are ready to change, if you are you are agile and you are ready, and you are realistically looking at everything with acceptance, you will be able to fit in, regardless of the economy, regardless of the country politics, regardless of the environment, etc., etc. Last but not least, stop overthinking and worrying over things that you cannot control. I think that is a fundamental thing that we all tend to forget. And so the easiest way is to ask yourself, what can I do about it? Can I control it? If I can, well and good. If I can't control it, then too bad. I will have to learn to accept, pivot, be agile, change, relearn, all the keywords that I've given you just now. So with that, I shall stop sharing and come back to you. Okay.
Thank you very much.
Shira?
Yeah. Thank you very much, Dato Aliyah, for the very insightful presentation, and thank you for taking the time to join us today. Ladies and gentlemen, we will now go for a 5 minutes break before going into the panel discussion on cultivating a mentally resilient workforce. See you shortly at 4:40 p.m. Welcome back, everyone. According to workplace mental health research by Relate Malaysia in January 2020, mental health conditions are often referred to as invisible illnesses with heavy cost to an individual's health, to family and friends, and even to organizations. In the context of organizations, 29% of workers have poor mental health with symptoms of depression, anxiety, or stress. Our panelists today will share their insights on how an organization can help employees manage stress, anxiety, and emotional issues through promoting and creating an inclusive workplace culture. Joining us today as one of the panelists is Professor Chris Baldwin, the CEO and Provost of Newcastle University Medicine Malaysia. Our next speaker is Associate Professor Dr. Ilhami Abdul Ghani Azmi, who is slightly late to join the Zoom webinar session. Dr. Ilhami is the Head of Leadership and Wellbeing Unit at ADAC University Malaya. Joining us as well is Dr. Sangeeta Kaur, the founder of Emerging Journey Asia and founding chairperson of Yayasan Health on World. Our fourth panelist is Dr. Edwin Ho, the occupational health physician and country health manager from Shell Malaysia. The moderator for this session is Ms. Premila Nair, COO of Newcastle University Medicine Malaysia. If you have any questions during the session, kindly type your questions in the Q&A box. Now, without further ado, I'll turn the time over to our next session. Over to you, Ms. Premila.
Thank you, Shira. Thank you so much for that introduction. A very good afternoon and a warm welcome, everyone. Thank you so much for taking the time to join us today. I'm really excited to start this interesting conversation. And it's a shame that we have to start without Dr. Ilhami, but I'm sure she will come in as soon as she's able to. And I'm hoping to have a really nice free-flowing discussion on this very important topic. And so without further delay, let's get started. So an article dated February 2020, and unfortunately, while I was doing my research on this topic, with regards to Malaysia, I could not really get, a very recent statistics, but an article dated February 2020 estimates mental health issues among employees may have cost the country about 14.46 billion ringgit Malaysia, or close to 1% of Malaysia's GDP in 2018, and says there is a need for effective measures to be put in place by companies. Relate Mental Health Malaysia founder Dr. Chua Sok Ning said mental disorders considered an invisible illness had been on the rise, with 10.5% of the population actually suffering from it in 2005 to 29% in 2015. Now, these are really alarming numbers, and as shared by Dato Aliyah in her plenary speech, COVID has actually brought about more discussions on mental health. However, this remains a topic, as much as we feel that, there has been more discussions, this still remains a topic that's poorly understood. And for many, this continues to be a hard topic to discuss. So let's start with Dr. Sangeeta. I guess what's important for everyone is to understand what is mental health and how different is this from mental illness?
Hi, thanks, Premila, and hello, everyone. It's a pleasure to be on this platform to share about mental health, my passion, and as you can see, my partner in crime is here. Okay, so when we talk about mental health, right, there's a lot of stigma revolving around the word mental health. So I just want you guys to visualize this, okay? I want you to look at physical health, and then now look at mental health, okay? So you have both looking at the word health. So why must we stigmatize the word mental? Are you telling me you have no mental? You have the physical, but you don't have the mental? No, right? So you have the mental health and you have the physical health, and we need to remove this stigma. Okay. Mental health is something that is so beautiful where you are able to socialize. You are able to function at a satisfactory level. Okay, meaning you are able to talk, you are able to have fun, you're able to exercise, eat, drink, sleep, do your daily tasks. So this is what we talk about mental health. And all of us will go through mental health challenges. Some of us can come out of it easily, but some of us might take some time to get ourselves out from the challenges that we are facing, right? And around less than 10% of the population will go into mental illness if they don't seek, treatment. So when we talk about mental illness, this is where you need to reach out to psychiatrists. You need to go through clinical assessment because you are unable to perform at your satisfactory level. So what is satisfactory level? It's like right now, okay, I'm sitting down here talking to you guys. I'm at a level that I can communicate, I can laugh, I can joke, I can share. So this is my satisfactory level. But there are people who might, have gone through or going through mental illness. They can't even sit. There's too many things running in their mind. And even an easy task will be difficult for them. So we need to understand we all have mental health. Okay, you cannot run away from that. We all have mental health challenges or problems or issues. I go through mental health challenges, trust me. Okay, even though I'm a licensed counselor, I advocate, I see patients, I see people, I go through mental health challenges. All right, and we need to take proactive to reach out, to seek out, to get support before we go into mental illness where we are unable to perform. Yeah, so that's it.
Thank you. Thank you so much, Sangeeta. And welcome, Dr. Ilhami. Thank you so much being able to join us now. Okay.
Thank you.
I guess as a society, we've heard and read numerous cases of people struggling with mental stresses, of working from home, of experiencing social isolation, and actually struggling to achieve work-life balance. And you're right, all of us have got, we do have mental health challenges, and I felt it when I was actually working from home. I think I'm in my element when I'm back in my office, and like, not that we are fully back in office, but we still have the opportunity to move around and walk around and talk with colleagues. And I guess the question that I'm coming from is, how do we then as employers support the need for that balance? Dr. Edwin Ho, would you like to take this question?
Yeah, sure. Thanks, Pramila, and a very good evening to everyone on the call. It's a pleasure to be here, and of course, Dr. Sangeeta was spoken before as well. So pleasure to be on the panel with you. I think if we go back to your question, Pramila, I like the point. What can employers do in this situation where mental health is becoming such a challenge and it's becoming more and more important in today's world? I would say that there's so many things that employers can do. But before I go towards what employers can do, I think we should take a step back and should just look at the situation and say, what can we all do? Yeah. So I just like to take a step to say that I think the responsibility of mental health is not one person or one party. In that sense, I don't mean that employers alone are responsible for someone's mental health. It's my mental health, it's your mental health, it's our mental health. Yeah, so I think we all have a shared responsibility. Yeah, of course there are times and the challenges where we face this situation at work, and of course that's when employers can come in and perhaps step up to do a bit more from that angle of supporting others. But I truly believe that it should start from all of us taking charge of our health. Yeah, and as Dr. Sangeeta said, if we go back to the WHO definition of health, it's social health, it's mental health, and it's physical health. But what's interesting about this tripathy is that the fact that they're all linked in this this whole health system. One affects the other, right? So you can't just be taking care of your mental health if you don't take care of your physical health, and it's the same with your social health. So I think let's start with acknowledging the fact that we need to take care of our health holistically. Yeah, that's the word, holistically. And then from an employer's perspective, there's a lot more that we can do. Yeah, and I believe that in part of the forum here today, we'll probably explore a little bit more of what employers can do. I just want to take the first point about what employers can do, and I'm sure this forum will go on. And so my very first view is that employers should care about their people. And the key word here is care. Yeah, it's a simple word, but it means leaps and bounds. It means a lot for people. How do you feel when you have your parents caring about you? You love them, right? You're in a safe environment. How do you feel if you're cared for among family and relatives? You feel great, you feel safe, you do much better. And what's the difference in workplace? Right? How do employees feel cared for at the workplace? And I think employers have a responsibility to do that, to ensure that they care about their employees at the workplace. And that's a great starting point, because care is so subjective. You and I might have a different view of care. It could be care as in I care about your meals. I mean, many of you here in Malaysia, and I'm sure Chris have experienced it as well. Whenever you meet someone, have you eaten? I mean, gosh, there's tons of questions that we could ask, but we will always ask if you've eaten. But that's a sign of care. We care about your empty stomach, right? But there's many other ways of caring. From the angle of your workload. How do you feel with the physical setup of your workstation at home and things like that. So I think I'd stop there and just reiterate the point about care. Thanks.
Thank you. Thank you so much, Dr. Edwin. Professor Chris, would you like to add anything to what Dr. Edwin has mentioned?
I totally agree with what Dr. Edwin said, and totally agree that it must be a shared responsibility between colleagues and the employers. But I think is what we must make sure as employers is that we're an open environment, and you could say caring environment, so we allow people to talk about it, because I think coming from the UK, I think things have moved on there. Maybe 10 years ago people wouldn't talk about it, but people do now. And coming to Malaysia, I think people are somewhat behind where people are now in the UK, and probably in the same place we were 10 years ago. So by showing that we actually listen, that it's a safe environment, that it's fine to be open about mental health issues. I mean, they're the things that we need to do as an organization, and that's showing how we care, if you wish. And then that hopefully will be able to give people the confidence to actually speak out and to talk to their line managers or people like me or each other, even to say that they've got these problems and not keep everything inside them. And so I think it's for us to show that caring by showing that we are listening and we are trying to do things. So that's what I would say.
Thank you, Chris. I'd like to take a step back, just a short step back. How has COVID made it easier or harder to talk about mental health at the workplace? Dr. Ilhami, maybe you'd like to take this question.
First of all, I would like to thank Newcastle University, Medical Institute for inviting me for this forum. And our honorable panelists, Professor Chris Baldwin, Dr. Edwin Ho, Dr. Sangeeta Kau, and our pretty Miss Moderator, Premila Nair. Talking about COVID-19, as explained by Dr. Harun, just now, he already explained that there are some effects of COVID-19, the pandemic COVID-19, to workplace, whereby there is an increase, okay, of mental health problems, okay, at workplace. So we can notice, okay, from the statistic that the number of cases, okay, is increasing, and this is quite alarming. And as employers, okay, we need to address these issues, okay, as soon as possible, okay, before it can spread. As we know, okay, employees are human capital, and employees are assets organization. So we need to protect our employees from the disruption. Okay, thank you.
Thanks, Dr. Ilhami. Dr. Sangeeta, so Dr. Aliyah spoke a lot about this earlier. What are your thoughts on how, how is it, how has the current situation made it easier or difficult to talk about mental health at the workplace?
Okay. Okay. First, we need to understand that before this is quite difficult. Okay. You see, mental health is something that you cannot see, you cannot touch. So therefore, we think that it's not there, right? And then, so we are so busy, getting things done physically, like, going to work, doing normal chores and all that. And right now, when you are at home, and it's like, you can't run away. You have to deal with it. You need to acknowledge it, right? And how much can you just put it aside and deny it, right? And it's been affecting because, before COVID, people talk about, oh, I love work-life balance. I need work-life balance. I need few days at home to work. But right now, if you put them at home to work, they'll be like, oh my God, I need to go out. Enough of staying at home, taking care of kids, taking care of family, work, and then your hours go haywire, right? And they can feel in terms of, it's projecting physically. They have pains, okay? And then the performance reduce, okay? Even the simple tasks, they can make mistakes, right? And more and more people are talking about it. Like myself, I'm with Italian, I'm volunteering in Italian Case. The amount of calls that we get, okay, during awake and during, night, like 1 o'clock in the morning, 2 o'clock in the morning, we receive calls, a lot of calls. So people are acknowledging it. There's a lot of research now coming out talking about mental health. Okay. There's a lot more. Yes, agree to what Dr. Chris was saying. We are lacking, and we need to rise above. We need to educate people. We need to know that mental health, like what Dr. Evan is saying, it's holistic. You can't say that, oh, I'm not taking care of mine. You need to take care of my mental well-being. No. And I've often been asked that, especially at workplace setting, do mental health starts from home or at work? You cannot say it's whether it starts from home or at work, because I give you a scenario, yeah? Okay, I have a good, for example, I have some sort of issues at home and I go to office, okay? And now I'm with Dr. Evan, and suddenly he's okay, he is cool. He has no problems, he has no issues, And while working, I start displaying negative thoughts, negative action, use abusive words to him. And not only once, I can carry on talking about, all this negativity for days, for weeks. And how would you think will impact him? Right? So I can say that, he can say that it's from work. But I say, no, this is how you're supposed to perform. You are at work, you need to perform at your best. I will start bambooing him. So we cannot say for definite that, oh, mental health, this part of mental health comes from office, this mental health comes from work. No, you don't break yourself into two. You are one wholesome person. So you need to acknowledge, you need to address this issue, and how? By creating, advocating, transferring knowledge, and let them experience, join classes, listen to webinars, when we talk about mental well-being? Yeah. I can go on and on, so I better shut up, right? Don't go on and on.
Pramila, can I just say, one of the reasons I think that people are speaking about it more is because it happened to everyone all at once. All of a sudden it went crack, and then everyone from myself, you, to everyone and all of our students suddenly had the same thing. And I think as it affected everyone, we suddenly realized that this would be affecting everyone. And that's why we've been probably more able to talk about it, because actually everything's happened to everyone all at the same time, and then allowed everyone once to suddenly realize that this is happening.
That's an interesting point. And actually, I just want to pick up on something. So I was having a conversation with an acquaintance this morning about this event. And one of the things that she mentioned was that, yes, she's a leader in her organization. And she said that, yes, we have colleagues who are struggling, and I've had to have conversations with colleagues who are struggling in terms of mental health, but I'm struggling as well. And she was saying, there are times as a leader I cannot appreciate what they are going through because I'm struggling as well. And I had no avenue. So she said yes, and rightfully what you said, Dr. Sangeeta, that as time you need to find something, you need to find an outlet. But while we were working from home, I guess that the outlet was not there, because where do you turn to? You are isolated. It is isolation to a certain extent, because you're not moving anywhere. When you're working, I guess when you're working, you have that right to work, that time for yourself to think, to rejuvenate, to whatever, get into the mojo of coming into work, and then you get into work. But here, you don't have that. If you turn around, you may have, a child that needs your attention, or in my case, an elderly parent who needs my attention. I mean, let me put it this way, it's the same. They still knock on the door and say, what are you doing? Are you busy? There's no space, right? So so what would the advice be to leaders who themselves are struggling and yet need to be able to address the issues that their colleagues are facing? Anybody would like to take that question? I know it was long. And Chris will always say that, I just waffle on until I come to my point. But yes, Dr. Edwin, okay, you're smiling. So maybe you're used to people waffling around.
Yeah, thanks. It's a tough one, to be honest, but I did notice that everyone else was smiling, but thank you, Permai, for picking me. So I'm just putting my thoughts together. I think it's true that the pandemic has caused a lot of issues, and everyone, as what Professor Chris has mentioned, everyone is affected at the same time. But there's something interesting about humans, and it's something that we've succeeded over the many generations and years as well. And I think one interesting point is that as humans, we tend to find ways. We tend to be able to cope despite the situation, despite the difficulties, despite whatever challenges. And we've done that for generations and generations, right from the start. And I truly believe that not everyone is going to go through a real downhill because of this. Yeah, some of us are still okay, and some of us, may not do very well. I think it's important to recognize that there are two groups of people. Let's begin with that point. Yeah, I think it's important that organizations and leaders and companies and employees recognize that it's not a one-size-fits-all, and you don't have the answers for everyone, because everyone's just at a different level of their mental health, right? And how do you then put the focus to those people who require more support? And I think that's when we talk about having access. Yeah. So part of the workplace strategies that we employ, I'll just quickly summarize. We talk about protecting people. We talk about prevention, and we talk about having good access. Yeah. And this could apply to any part of the mental of health. Yeah. So when it comes to access for mental health is really where they could go. Yeah, and this is when awareness is important. This is when you have regular briefings and telling people that, look, you've got these options, you've got these places that you can go. So I'll share with you a few examples that we have here here in Shell. And what we have is something called the EAP, the Employee Assistance Program. So we've subscribed to this program, and we've had this program for some time. And during the pandemic, we recognize that people, not just our staff, are affected by it. So we expanded the services to their families as well, because if you're fine at home every day, but you've got to take care of 2 or 3 different people who are not fine, you're not going to be fine at the end of the day as well, right? So we've extended that service to beyond employees, and we've seen that take-up rate is pretty good. And we also give extra awareness on what the EAPs can do. So lots of people think that EAPs are your go-to when everything goes wrong, right? When it's just the end of the world and you don't know what to do, you go to them. But in fact, as you slide down that hill of progressing in worsening of your mental situation, at any point you could actually call them, or even when you're in your tip-top condition, because that's when you can stay tip-top. That's when you can stay at your best. And the EAPs that we have today, they're just amazing, and they've really stepped their game up. So I would say that that's the first thing that any employers or any organizations could do. Yeah? Just have an avenue for people to access support and help, right? Of course, the EAP would then provide referrals to psychiatrists and the medical professionals if the next level of medical professionals in the hospital if needed, right? But not necessarily all the time. Now, the second thing is that we train our people. Our people talking, what I mean by our people is that we have leaders in the organization. We have got volunteers in the organization, and these people are trained to be able to manage and help others who are in doubt. And these are the people, when somebody volunteers for this kind of thing, they're very passionate about this. They really want to go out there to help. Yeah, but we're not training them to be doctors. We don't train them with psychological first aid as well. The only basic thing that we train them with is to recognize change, recognize that someone needs help, be there, listen, and direct them to the professional help which they could opt to decide for themselves. So these are some things that we've done in our organization. I think it's been effective. So even as leaders themselves feel under pressure, they can go to the EAPs, or they could go to their leaders, because in every organization there's always going to be a leader of a leader, or in Malaysian term, there's always going to be a boss. Yeah, I'll just pause there. Thanks.
Thank you, Dr. Edwin. So coming back to what Dr. Edwin said, maybe Dr. Ilhami, you'd like to take the next question.
Actually, I concur with Dr. Edwin, okay, about the EAP, okay. In the case that the employer is struggling, to help their employees with stress, anxiety, and depression, I think there are other ways that employer can help their employees in terms of reducing their stress level, their anxiety level, and also depression. I can suggest one simple example that employer can practice is conducting a stress audit, whereby the employer can conduct stress audit by using a tool to evaluate the level of work-related stress that has been extensively used, which is known as WSS, or we call it as a work stress scale. And this scale include 5 or 6 dimensions, which are relationship problems with superiors, bureaucratic constraints, work-family conflict, relationship problems with colleague, performance pressure, and poor job performance. So I believe that this is actually a stepping stone, or the initial step that should be done by the employer first. That is to assess their stress, their employees' stress level first.
Thank you so much. Chris, so being an employer, being the CEO of an organization, at what point do you think employers should step in? And are they are there ways of keeping tabs on employees' performance, or do you wait for the employee to come to you for help? Like, what is the right balance?
It might help if I unmuted myself. Obviously, technology gets me, as you know, Pramila. I think it's very important, and I'm sorry, I can't remember. I think it was Dr. Edwin said this, that we've got to train our colleagues, particularly leadership, in how to recognise changes in mental health, and it is in the training that I've been. It's about change. You see change in people. People will change, and I think that you need to do training. I don't think mandatory training is necessarily the best, because people who aren't interested in it aren't going to take any notice. I think you need the people who are interested to actually do it. Actually, our colleagues, and I'm sure Dr. Ilhami will know this from university, our colleagues are very good at recognising change in students, and they see change in students, and it's something we're meant to look out for if there's change in students and how their performance and what's happening, and we're very good at that, and we probably don't do it as good for each other and actually notice it for each other. So I think for me, it's about the leadership and colleagues across the whole of the institution noticing change. I think in the first instance, it is for colleagues to come to us. I think you can't jump in right at the beginning and you see something. I think that as time goes on, and if you see significant change in someone or significant, and I don't think it's performance necessarily, performance can be affected by many different things, but I think it's about changing people's attitude, people's change in how they're communicating. I think, as Sangeeta said this, about how, whether they're turning up on time, lots of different things. You can see these changes and pick up, and you can see that. And then as you see that, if it starts getting where you might be significantly worried about it, you might, and it could be you just go along to someone and say, is everything okay? But actually, is everything okay? Everyone will say straight away, yes, I am okay. But try to think about what's happening. Is there anything I can do to help you? And those sort of comments that you want to make to people. If you were really worried about something, then I think that then you might need to take it up with one of the senior members of staff. But you can't force anyone to go. I mean, we have a counsellor here that staff and colleagues can go to. We can't force them to go to those things. So I think it's about us being as good as we can and talking to people and looking out for changes. And I think that if we look out for those changes and talk to people at those changes at the higher levels, then hopefully it doesn't get too bad when people are worried about things when it's really difficult to change.
You're right. And I totally agree.
Can I just say, Pramila never says that I'm right, so that's very good.
Come on, Chris, you agreed with me this morning that we do have some areas where we do say, we do agree on. I guess, but one of the things that I really want to pick up on is, and I think it's a culture issue. People generally don't want to speak about it, or they feel that, especially in work relationships setting, people are really reluctant to speak about their mental and emotional health. They can speak about everything else under the sun, but when it comes to their mental and emotional health, there's always this armor, like, if I speak about it, that's my weakness, and I don't want colleagues to see that weakness. How, as employers, can we address that? Maybe Dr. Sangeeta, you'd like to take that from your perspective. How do you think that can be addressed? And is that really the case that people just don't want to speak about it?
Okay, culture does play a role. Okay, your family values plays a role. Yeah, and sometimes even religion plays a role. I think most of the time religion plays a role, right? So I always tell people, don't use religion when it comes to mental health, because you can tell, you pray, you do this, you do that, and they know more than us. because that's the first thing people do, is to pray, to seek help and all that, right? One way that I always advocate or ask organization, whether it's employer, employee, head of department, anyone, yeah, even right up to your kids, understand their personality. Because what works for me might not work for you. Okay, and there's a lot of diversity in terms of personality. And when you add on with culture, with values, with so many different things, sometimes we are confused with who are we. Okay, so when you know that, okay, this is my personality, all right, this is how I can work things. How can I do differently? How can I leverage on my strength? And how can I collaborate with someone who have my weaknesses or my blind spot? And then you can see a shift. That is one, understand your personality. And then if you're in the organization, collate everybody's personality and see your culture in your organization. Because, you know, the bosses can come with their own culture, okay? But the moment you employ people, okay? For example, if you are hiring and you have a certain set of personality, you will hire someone similar to you. So you need to understand the whole structure, the whole culture of your organization and see, are they more analytical because you are analytical? Are they more social? You know, so you understand the dynamic, not something that you just write and create a culture, but you know, people coming in, going out of your organization, you need to do this on and off. Understand the culture, and then see how can you use this to advocate regarding mental health. If you are an introvert and you don't like to express yourself, I'm not going to share with you my issues. I rather keep it to myself. If I'm coming from a close culture, close family settings, you know, I would not want to share, because what will the society see when I share? It will bring shame to my family, right? So there's no right or wrong, because as much as employees go through mental health challenges, I bet you employers are going through a lot more to manage so many, right? So it's good to understand the personality, look at the culture, put in and show them that, yes, we are open in addressing mental health challenges, and these are the resources and avenue you can go to, all right? Give them the link, give them the resources, all right? And if you need help, like what Edwin was saying, we have EAP, right? Channel them to that, all right? Once in a while, engagement. So by you as an employer, start talking about it, start advocating, walk the talk, then you can see, because the change starts from us. And we cannot force people, like Chris is saying, we cannot force people to, you know, to you go for a session, you go and seek help. We can't do that. And trust me, a lot of people just resist help. And we can't force them. There will be a time, it's either they realize and then they reach out, or it goes to the bad state where someone else needs to drag them, you know. But we cannot force, because the moment you force, it's a different ball game already. Even in counseling, when I counsel people, right? You know, there's resistance if the employer sends someone for counseling session, because then it will be word of mouth in the department, in the whole organization. You know what I mean? So that is why we don't force. We show them that we support, we advocate, and these are the resources. So go and reach out. Yeah.
Thank you, Dr. Sangeeta. Dr. Ilhami, what are your thoughts on this? Like, how, you know, how do we encourage people who generally are reluctant to talk about mental health and their emotional health?
Okay. Yeah, I agree with Dr. Kao. Okay. This is because talking about mental, okay, it's a taboo. It's a quite sensitive issue. Okay? So nobody wants to talk about mental problems. Even the employers, okay, they are reluctant to solve the problem and also to address the issues, and solve the problems. This is because, okay, nobody wants to call as cuckoo or crazy or tanjung rambutan. So if they hear cuckoo or crazy or tanjung rambutan, then they will either laugh or they will either got scared. So this is very sensitive issue. As employer, as organizations, okay, we need to encourage our top management not to feel dissolution about solving the problem of mental health issues at workplace. As I said earlier, employees are human capital. Employees are assets of organizations. So they need to protect their employees because the employees, they are able to perform well. So it's not easy to replace them. And if you want to replace these mental disabled employees, then it's going to incur costs. So this is again not a solution for the employer. So I agree with Dr. Kau that the employer need to address that personality of the employees is the factor, because personality is the factor that causes to stress. So in that case, meaning that employers or organizations need to keep that in mind in recruiting and also selecting employees. For example, they need to employ only resilience employees. This is because with only resilience employees who are adaptable and they can adjust to changes in the organizations.
Thank you, Dr. Ilhami. Thank you very much for that. Okay, we've got a question here in the chat, which is quite interesting and probably is something that Dr. Edwin might answer. I mean, I saw him unmute himself, so I think he's ready for it.
Yeah, I kind of raised my hand because we don't have that raise hand feature over here.
Oh, sorry, I didn't see that. Sorry.
No worries, no worries. Before we get to Isaac's question, and thanks, Isaac. I think that was that's really a good question. I just wanted to share, my personal experience as well, as a doctor, but as a friend, like many others, and it's talking really about that stigma that you spoke about, mental, physical health. If we injured our leg or if we sprain our ankle, will come in clutches, or somebody will come in clutches, and they'll be so proud to say, oh, I was playing badminton the other day, and I had this injury. When it comes to physical health, people are just so calm about it, just so cool about it. In fact, some people think it's quite cool to show that arm sling around your, and hey, do you want to sign your autograph here? But it is so true that when the opposite comes, when it comes to mental health, for example, people just don't talk about that, right? And I think that's the big divide that we're seeing here. Of course, in all that the speakers have spoken about and the panel has spoken about is trying to tear this down, right? How do we remove this stigma? And perhaps this is one tip that I'd like to share with our audience here today. And I think this is a very, very important tip. It's called building psychological safety at your workplace. Now, some of you may have heard about this. I think the pioneer who wrote about this was an American. Her name is Amy Edmondson, Professor Amy Edmondson. So she wrote about how do you create that safe space where people can voluntarily talk about this. Yeah. So I'm moving a little bit from the social aspect, friends meeting up, to the workplace, where we would be a little bit more professional, and things might be a bit different from the social context. But I think it's important here to recognize that having a psychological safe workplace is the key to getting people to express themselves, right? because as we all know, there's so many factors that stop people from putting up their hand and speaking out. You know, they could be shy, they could think that their performance will be affected, they don't want their future to be affected as well, and they don't want to get that stigma from friends like, hey, you know, that guy is something wrong with that guy, or something wrong with that lady. You know, they don't like that kind of stigma. So how do we create that psychological safety? That book is a great introduction to it. I think it has also very good tips. The book is called The Fearless Organization. It talks about how some leaders or managers may think that they're allowing the people to talk. You know, I can give you a very quick example here. And maybe a colleague of mine is Sarah, and I would go like this: hey Sarah, you don't look too well. What's wrong with you? Are you okay? You don't look yourself. What do you think Sarah's going to say? You know, building on from Professor Chris' comment earlier, you know, the first initial thing that people are going to say is, I'm fine. I mean, how many of us actually stay to hear what people say, you know, or respond when they go, good morning, how are you there? You know, I work in a corporate environment. I go into the lifts and I meet people along the way. And there are days where, you know, I'm just, you know, in my own thoughts. And when somebody greets me like, hey, good morning, doctor, how are you there? I wasn't going to say I'm okay, but I was just thinking, you know, a few more seconds what I was going to say. And when I finally thought like, well, actually today isn't the greatest day, where did that guy go? So how are you is used more like a greeting in today's times. You know, people don't really care how you are. And that's the change and the shift that we need. We need to go back to the basic of how are you? And I'm here listening to you. You're okay? Oh, nice. But you don't look yourself. Is everything really okay? And you might need to go on and on and on. But it's just not probing and being an irritant to people. There's so many other factors. I suggest, you know, have a look at that. Study deeper what psychological safety. There's this other guy, his name is Timothy Clark, and he shared about the stages of psychological safety. How do you build that psychological safety in whichever your organizations are? And I know that a few audience here that are coming from different organizations. So I hope that helps. You know, it's not just about probing, it's not just about asking people to speak up, but it's about providing that platform in every way, in every action that you do. You know, your company policies, is it all right for somebody to say, I have a mental health condition? Because that company policy may say, I have a mental health condition and sorry, you're on the way out. You know, that's the exit door. So, you know, however nice and you know, honey coated you want to put the whole, how are you? Nobody's going to say, I'm not okay, simply because the environment doesn't allow that person to say, I'm not okay. And let's dive a little bit deeper into Isaac's question over there. And thanks, Isaac, for raising that question. I think it is true that, you know, people and organizations, let me just start with organizations. I think, you know, typically, whether it's a large, medium, or small scale organizations, we're all very profit-based organization. It's all about profit, it's all about dollars and cents. But I think what has changed along with this revolution, or the IR 4.0, is the fact that employers need to start taking care of people, as what was mentioned, human capital. Prof. Hamid just spoke about that. You know, people are your greatest resources. How do you take care of them? How do you make them feel that they're part of the family in the workplace, right? And I think that is going to be key in deciding whether people stay in the organization or they leave the organization. If I am in an organization that is going to give me a good pay, I'm happy. Of course, I'm happy. But if I take a stone and throw it around me and I look around, and probably there'll be a few other organizations, not too many perhaps, but there'll be a few organizations that will also offer me what this organization is offering me. So what's the differentiating factor? And I think that's the question that Isaac is really targeting on. And I think that's laser spot on, yeah? I think that differentiation is how you care about your people. And it's not just how you care about them, but how they feel cared for. You know, it's very easy for us to say, oh yeah, honey, I love you. But does honey actually feel loved? You know, it could be, you know, whoever that person is, yeah? So I think it's important that organizations start to consider how employees feel, you know, take care of them, their well-being, their physical health, their mental health, their social health, go beyond and build a culture in the organization that it's not just the CEO, it's not just the leader who's saying, yeah, I know all that, guys, I care about you. But down the line, the middle management, the lower management, the supervisors just don't care. Like, hey, you get to work. What you're doing. You've been off for 2 days. Get back into work. I don't care. Your COVID, is it? You got COVID? All right, you're working from home. You still can work. Make sure you log on. I want to see you at 8:30 tomorrow morning. This kind of things doesn't help. So sorry, it's a bit crude, but I think I just wanted to point out the reality and what's really happening out there. So I hope that helps in that question as well. Thanks.
Thank you, Dr. Edwin. And yes, you are so spot on. It's not just about the leaders who are walking the talk. It's about the middle management. It's just about everyone, isn't it? Everyone needs to be able to say, I care, I really do care. And that comes back to my question on empathy. I think one of the things that we realize is not everyone is tuned in that same manner. As much as we say, I care, but, I can actually say it as, yeah, I care, and nobody will come to me if I say, yeah, I care. So we have, not we, but in my conversation with friends out there, they've told me a million stories of how their bosses expect them to be at the desk at 8:30, who expect them, your lunch hour is just at 1 hour of lunch. You're not allowed to take more than that. And I think there was a classic case where one of them actually mentioned that every hour the boss will call in, just to make sure that the employee is actually working, calling in at home. And there's no such thing as you having a sick child or, having to care for personal matters and all that. But on the flip side of it, she said later on, as she spoke to the boss, it was the boss checking in to see that she was okay. So, it's that balance. So how do we then strike that balance, Chris? How do we then try to strike that balance of being empathetic and showing that you're empathetic, and not being empathetic, but your actions are on the reverse?
I'll give my worst example of this that I ever saw, and it was actually in India, and I was actually recruiting students, and I was in an office in Hyderabad, I think, and I wondered what the cameras were, and she said, the boss in Mumbai has cameras in all of the offices, and he's watching everyone all the time to make sure they're actually doing their work, and I thought, I thought I better be very good, but that his excuse was he was just making sure that everyone was okay and it was all fine in the offices, but that wasn't true. How do we make sure? I mean, it's difficult to get the balance, and I think one of the things you don't want to, as the boss, we don't want to micromanage, we don't want to be chasing people all the time. I guess. And like we always know, we say the door's open, but will people come along and come in that door to come and say hello to you because they're worried, they don't want to disturb you because you're the CEO or something like that. So it's a balance of showing that you're open, showing that you will speak to people. Maybe myself and you or others going out and walking around a bit more and sitting down and having a cup of tea. Now we're back allowed to go into the canteen and seeing people and saying. Seeing people and things like that and going on. And I think the other thing that's very important is change is very difficult for people, and everyone's going through huge amounts of change now. So it's making sure that we communicate, and maybe we haven't been good enough at that ourselves, and communicating to people about what we're thinking about changing, and then why we're changing, and letting people know what's happening, because change causes a great deal of stress and a great deal of worry and a great deal of anxiety. And if we can make sure that we communicate why we're changing things, why we're adapting things, what's happening, I think that will make people feel better. But to see us communicating as leaders to everyone, then that may allow people to speak to us more openly as we go along, because I know people are worried about speaking to me because they don't want to make other people in trouble or things like that. But I think maybe it's more beholden on us to get out a bit more and speak to people.
You're right, Chris. And I think that's something I have to share. That is something that Chris loves doing. He loves walking around the campus, you know, and he loves taking photographs. So people who follow him on social media, on Facebook, will know that every day it's about photographs, and that's how Chris is. He's just this bubbly character that's walking all around the campus. And I mean it in a good way, Chris. I really do.
Well, I still don't talk enough to people, is what I probably is meaning. You still need to sit down and listen, as others have said, and actually listen, not just say how are you, but listen to what people are saying to you.
Yes, totally. Okay. I guess now that we are seeing the workforce transitioning back to a full return to work, and if we put it on the other side of things, people have been comfortable working from home. Not everyone, but some have been really comfortable working from home. And the fact that they need to return to work has put on that added pressure or the added stress of returning. How do we ensure as organizations that we continue to pay attention to their well-being, now that we find that we need to return to a normal routine? How do we continue to do that? Dr. Ilhami?
Okay, thank you, Ms. Nek. Well, to me, okay, I think the organizations need to come up with some sort of training first, okay, before they call their employees to return back to their office, because as you said, okay, it's going to be something like a culture shock, okay, to them, okay, to be returned to work without any preparation, especially from mental aspect. So like UM, like EDEC, especially, okay, we come up with training, especially for teaching and learning. Okay, we call it as a hybrid teaching and learning for all lecturers. So all lecturers attended, okay, for the training, and so they are prepared, okay, for this sort of returning back to office. And then the next stage is that, okay, the faculty, okay, take the responsibility of training of their lecturers to teach physically with their students. So this is a kind of what EDEC or UM, okay, is doing at the moment. And now, okay, we are now in first week.
Thank you, Dr. Ilhami. Okay, so I'm really conscious of time, and I've got two questions that I really need to ask all our panelists. So my first question, and we did, I think the panelists did touch on this topic in their answers, but it's about stigmatization. So the journey of a person suffering from mental illness is not an easy one, especially when there's so much of social stigma attached to it. And for this group of individuals, having to carry that additional burden of stigmatization is definitely not helping them at all. So what can we as employers do in ensuring that colleagues suffering from mental health issues are actually supported, especially at the workplace? I'll start with Chris, because you're the first person that's appearing on my screen.
I mean, very quickly, I think, once again, this is about being open, showing you're a caring employer, which has been mentioned before. Show that we as senior management actually take the issue seriously, that we are serious about this, And really, this is deeds, not words. I mean, we can have as many seminars like this as we want, but we've got to actually have show that we put in the support. We have our various counsellors or various bits and pieces that we put in, and that we will look after people. So I think that's. And so we must be seen to be doing things and supporting people. I know we can't talk about people individually because for privacy and things like that, but there must be at least people see that we put in processes that people can support. And then I think it's the other thing is to be supportive. We need to get advice from experts like Dr. Sangeeta, Dr. Edwin and others to say, what can we do? What is the best practice in the field? Actually look at what's the best practice. And I think particularly we do have to look, although we're a British university, we have to look at what's the best practice in Malaysia, because what works in the UK will not work the same in Malaysia. And we have to look at what's the best practice here for different ethnic groups and different people, because different ethnic groups will have different needs and different things to look at. So I think it's beholden to us to say, to actually go out and do things and then report that back to colleagues and say, look, we've gone and done this, we've talked to these people, this is the advice that we're getting. Do you think this is right for you? And actually ask our colleagues and then get feedback from them. And that's what we should be doing.
Thanks, Chris. Dr. Edwin?
Hey, Pramila, just a quick check. So what your question is really about how do we break the stigma at the workplace? Is that a summary of the question? Okay, thanks. So not wanting to go, not wanting to repeat what Prof. Chris was saying, because I think that's very valid. Being very specific and making it fit for purpose. I'll just quickly run through a few tips that organizations can do to talk, to really address the stigma at the workplace. Normally, people would think that it's perfectly fine and it's just good enough if I run a mental health session. I just get in a professional to come in and talk about this. But that's just scratching the surface, to be honest, and that's not good enough. Yeah, so we've got to do more. And when I say we as in an employer, we really need to do much more to show our commitment. I think the basic we could do is to start with our own policies and the leadership steer. So always start from the top. It's got to be leaders, it's got to be the CEO, it's got to be the C-suite, it's going to be the senior managers saying that, look, mental health is important to us. It's okay for you to say that you're not okay. And it starts with the leadership backing that up. Yeah, so I think that's very, very important. And then you can have sessions and programs that you come along the way to address mental health and things like that. But you also want people to speak up about it. So you got to build communities. So what we do in our workplace is that we build communities for people to talk about their mental health. We build communities for people to just talk about anything, especially relating to the struggles that they have, the reasons why they're not okay, and it's perfectly fine. Yeah. So the tip here is use innovative technologies. Today everybody's on social media, so get on one of your enterprise social media. Here we use Yammer. I know some people use Facebook Office and MS Teams and things like that. So just get on one of those and allow people to share and express themselves. And another tip, which I think is very, very important, is to talk about this at the team on the ground level. It's perfectly fine to get, when senior leaders start talking about this and being very, very personal, it makes the next level think about it, talk about it, and be personal about it too, right? And then that cascades all the way down. So people start realizing that, hey, look, my leader speaks about that. My leader is not perfect. My leader went through a very, very tough time dealing with work, newborn and some domestic concerns at home. And there was all these issues that my leader was suffering. In fact, sometimes we feel more care for, or we care more for people who, go through this, So it doesn't mean that just because you're a leader, you need to paint that perfect picture of, I'm a perfect person, so you got to be like me. No. So I think it's all right for leaders to show the vulnerability, especially coming around mental health. And that translates downwards as well. Then people will start saying like, hey, you know what, it was tough for me here and it was tough for me there as well. And together as a community, how do we find that support? So the support for the community is also very important, because sometimes, and this was mentioned earlier, a leader can't settle every problem. And sometimes a best friend can, or a best colleague can, right? And that's what communities are about. So I think it's many different layers of the organization that we need to start tackling if you want to talk about stigma. But it starts from the top, and it starts with sustainable programs. It's not a one-time program. It's not a one-time panel or a forum like this that would change your people's view on mental health. It's something that continues to build. And let's think about this. A culture is repeated actions built over time. And that's exactly what we're aiming for. So I hope that helps. Thanks.
Thank you. Thank you so much. Dr. Ilhami, your thoughts on this? You need to unmute, Dr. Ilhami.
Thank you, Ms. Moderator. Okay, in this case, I think I tend to agree with Prof. that talking to people, okay, is the best solution. In order to reduce stigma, I think the top management, okay, need to inform, okay, to the line managers to discuss mental health, okay, in their meetings. What I mean is that, okay, they need to normalize mental health discussion, okay, in their meeting. So by then again, mental health problem, okay, wouldn't be something that employees, okay, need to be ashamed of or scared of. The managers, okay, should communicate that talking about mental health, okay, will lead to support and not discrimination. And I think that's the best solution. And this is the first step, okay, that should be taken by the organization.
Thank you. Thank you so much. Dr. Sangeeta, your thoughts, please.
Yeah. Everyone
Save the best for last, Dr. Sangeeta.
Now I have to think of an answer, no, what to give differently. Okay, the first thing that I would like to address when we talk about stigma, right? Okay, people with mental illness, they are still able to function. You need to know this, yeah? Doesn't mean if they have mental illness, they are unable to work, they are unable to do things, no. If they have the right treatment, that means taking their medication, seeing psychiatrists, and at the same time going to therapies to understand the core issues, the problem, it must go parallel. Then, these persons they are able to work. We are not talking about the severe where you have to go to Tanjung Rambutan, mental institute. We are not talking about that, yeah. We are talking about people who have mental illness. Okay, then we need to break the stigma that they are able to work. They can perform even better than people who don't have mental illness. Okay, and then I would like to ask this question also. What does mental health means to you? So yes, we have the definition, but your internal, your personal definition, because we can talk about mental health, but words and action is two different things, right? The third thing is, when you say that I'm here to talk or I'm here to listen, are you actually ready to listen without judgment? Okay, and listen attentively, because sometimes or most of the time we listen because one, maybe we are kepo lah, we want to busybody and ask what's the next thing, right? And then we listen based on our personality. If we are somewhat analytical, we like to listen to facts, data, figures. We don't want to look, we're not saying we don't want, right? Subconsciously, we will listen to that because that's our preference. Okay, so now you need to understand the meaning of it. Why do people react differently? Because sometimes when I listen to people, right, in my mind, so simple, so you are like this, but for them it's real case. It's true to them and it's hard, right? So that is where the empathy comes in. To understand, yes, even though I'm not in your shoe, I'm not in your position, but I know that it's real for you. It's not that I know I feel for you. I know that it's real for you. Because we all feel differently. All right? So when you start to acknowledge that, when you are more open and you know, the rest has said it very well, right? From the leaders to the management, to the employees, the whole ecosystem needs to talk about it. And one thing people find it very difficult is to have courageous conversation. Because the moment we talk about courageous conversation, it's always about fighting, conflicts, you know, stabbing here, talk words and all that. But respect, you know, have the conversation in a respectful manner. Instead of saying, you know, you are this, you are not doing this, you are that. Instead of blaming, where the person will feel like, you know, what are you talking about and all that, start to rephrase your words, you know. It doesn't make you a lesser person by saying, you know, I appreciate if we can look at it better. I appreciate if you know, if you need certain help, or if I need help, can I ask you? Correct me if I'm wrong. Is this what you are saying? You see, words plays role. Okay, so we need to be mindful. We need to live in here and now moment. Don't talk about what's happened in the past. It can teach us a lesson, but we cannot blame and start pointing fingers and say, you know, this is what you did, you know, past. This is what you did. It doesn't benefit anyone, right? So look into it. Educate yourself, because I'm still educating myself in terms of mental health. There's a lot of things to learn out there. And everyone that comes to me, it's so many different things, and I cannot use one. There's no one model fits everyone. It's so many different things. So we need to do that. As an employer, as the boss, as the managers, or as employee, you know, what mental health really means to you. And when you do that, right, start journaling down, relax your shoulder, don't be too tense. If you are tense, you are close, you have your defense. Just relax and then start writing it, okay? Drink your coffee, listen to music, you know, and just talk to yourself. Look in front of the mirror. How many of us actually look in front of the mirror and embrace ourselves? Just, you know, these many people, because your negative self-talk is huge. Okay? And from the 60,000 thoughts, there's a lot of research I've done, 60,000 thoughts in our mind every single day. And 80 to 85% is negative self-talk. So start being mindful and be aware of your mental and your emotion. It works together. Huh? Okay. Thank you.
Thank you. Thank you so much. Thank you. That was really, really insightful. Yes. How many of us actually look at the mirror and have that reflection like, yes, you know, I think if my kids were listening on to this, they would probably be saying, Mommy, you do that all the time. But they just say I'm vain. So, you know, you can't win everywhere. Okay, I can't believe that we've really come to the end of the session. But let's do a quick speed round, very quick. Give me one thing that you want to share with the audience on what we each can do to maintain our mental well-being on a day-to-day basis. And I know, Dr. Sangeeta, you touched on this a little bit, but I'm going to come back to you now, since you said everyone else gets a chance to speak first. So now it's your turn. Very quickly, what can we do to maintain our mental well-being? 1 point.
Okay. My mantra has always been nothing personal. 1 point only, right? So I'm giving you 1 point. Nothing personal. You are different, me different. You want to tell me something, I'm just going to listen. If it's good, I take. If it's not good, I'm just going to let it flow like the river. Okay, 1 point, done.
Fantastic 1 point. Dr. Ilhami, your 1 point.
Okay, to me, everybody has to understand that they have to play a part of not triggering mental health at workplace. That is not to be a bully, or to discriminate people in order to get what we want. Okay, in short, integrity, okay, should be upheld at workplace.
Thank you, Dr. Ilhami. Dr. Edwin.
Okay, I think for me, it's going to be about embracing diversity and inclusiveness. And the key point is that if you're not intentional about including someone, you could be accidentally excluding someone.
Thank you. Finally, Chris.
I think it's just about active listening to people and actually really listening. Like with you, I normally go like that, but actually listening and actually, yeah, it's about listening to people and trying to understand what they're saying.
Thank you, Chris. Thank you. I know you say that, but you don't. You actually listen to me. But anyway, I would like to take this opportunity to thank all our panelists for sharing their experiences with us. And I'm sure the audience will agree that there's just so much to take away from this session. In fact, I've been getting WhatsApp messages saying that this is one of the best sessions that we've had. I mean, so thank you so much for being part of that session. I guess all in all, in achieving good mental health should be thought as it is a constant work in progress, isn't it? That, you know, there's no end to it. And like it was mentioned earlier, mental health affects all of us. And I think as employers, we need to play our part as much as the employees itself in ensuring that we are responsible, we are caring, and that we are empathetic. With the right resources, with the right working environment and support, I think we can definitely move towards creating a workplace that's both inclusive and collaborative. So to my panelists, my esteemed panelists, thank you so much for your time and your insights. It has been so helpful. Thank you so much. And back to you, Shira.
Thank you very much to Ms. Pramila and all the panelists for the excellent panel discussion. Ladies and gentlemen, we have now come to the end of our session. Thank you very much, and I hope you have found the session informative. Take care and stay safe wherever you are.